The Highline program developed over the course of 2 years, but actually it started when I had 6 hours where I could actually be in a hammock and read a book. And when I read this book, I was astounded by the effect of laser light on the brain, particular aspects of the brain. And I was left with questions about, well, that's great, but how do we know where to apply this light and this energy? Over the course of the next 2 years, I figured that out using quantitative EEG and hyperbaric oxygen and various other techniques of how to direct the energy to heal the brain. The Highline program is incredible. Why do I say that? Because with the very first patient that I treated, I was simply astounded, really blown away. I couldn't understand the efficacy of the treatment. When a woman who had facial blindness was able to actually remember faces for the first time in 7 years with one treatment. Most people don't respond with one treatment, but some do. People with aphasia have been able to recover 50 to 75% of their ability to speak. There's no other program that I know of that can target the areas and the symptoms of the brain using specific technologies and actually measure the change, correlate them with symptoms, and then target very specific treatments to actually rebalance, regrow, or tone down those particular areas of the brain with precision. The primary benefits that a person can expect from participating in the Highline program is a fairly rapid recovery and resolution or significant improvement of brain-based symptoms such as aphasia, trouble finding words or expressing themselves, or early signs of dementia. These can be resolved relatively quickly with the Highline program. I was trained at Georgetown University and the National Institute of Mental Health, and then went on to be a clinical professor of psychiatry at Georgetown University. I'm certified by the Institute for Functional Medicine. I'm also clinical faculty at the Institute for Functional Medicine. I have been a member of the Endocrine Society and Adolescent Psychiatry Society and various other societies, and I've written 3 books, and I've been lecturing around the country for about 40 years. The Highline program is designed for people who have brain-based problems such as aphasia, difficulty finding words or expressing themselves or understanding language, and people who have early dementia, mild cognitive impairment. There is no accepted effective treatment for aphasia. There is no accepted treatment for early dementia. Yet, through the clinical and basic science, I have been able, over the course of time, to put together treatments that actually do work and are effective based on objective data and measurable results. It's well known that it takes 20 to 40 years for a new medical treatment to come into mainstream medicine. Because I am in my own practice, I am able to be nimble and follow the basic science and the clinical research as it emerges, and based on this, I've been able to develop the Highline program and objectively measure its efficacy with my patients. This technology will eventually become available to the medical world in 20 to 40 years. I know that this is costly, but what you really need to realize is that, what good is money if you don't have your brain? What kind of life you're going to have? In fact, one of my patients said to me, I have some money in the bank, but what good is it if I don't have my brain? She enrolled in the program, she recovered, she did quite well, and in fact, her business is doing better than it's done ever. In the long term, if you have a process such as aphasia or early dementia that's going on, you are going to actually have very high costs down the road with nursing care, nursing homes, plus loss of quality of life over the course of years. If you treat it now and you invest now in prevention and recovery, you actually get years on your life and you actually reduce your long-term costs. Our treatment is precisely and finely tailored to your personal needs. We are constantly evaluating how you're responding to the program, constantly measuring objectively and subjectively how you're doing, and there's a continuous process of amendment and adaptation of the program to your needs. We work very hard to help support you in this program because we realize that it's a good deal of work for you. We help you to organize it. We have a coach that can work with you. We have a nutritionist that can work with you. We have a nurse that works with you, and they're on call whenever you need them. I myself am also available as needed to help support you through this program. My job is to be in that boat with you, paddling the boat with you. I can help people with early dementia or aphasia by actually looking for the root causes of the problem. Not all dementia is the same. It's really an umbrella term. Under that umbrella are different syndromes, different types of dementia. For example, if you have pneumonia, there are many types of pneumonia, and the treatment depends on what type of pneumonia you have. Same with dementia and aphasia. What is the source? What are the sources of the problem? That's what we do. We look for the source of the problem, we identify the sources, and we treat them, and that's how we get results. People ask me, actually very often, what drives me to do what I do with such passion? And the answer is that I'm addicted to success. When I have a success in somebody who had no hope for improvement, no hope for relief from their symptoms, I am simply over the moon. I can't get over it, and I want more. I'm driven to help people get better, and I really like to solve medical problems, so I'm a medical detective. That's my approach. I delve into the deepest aspects of the science, and I use that to my patient's advantage. When it comes to early dementia, mild cognitive impairment, and aphasia, the only approach that can work is a personalized approach. One of the most important things you need to know is that when you come to our center for treatment, we're going to be looking at you. We don't look at the disease or the symptom, we look at all of you. We look at the individual aspects of your health, of your life, of your family life, of your career, of your exposures, of your history, of your laboratory data, of your brain. We look at every single thing that could have relevance to you. So it's extremely personalized. Even if you think of the word personalized, it doesn't even do it justice. We look at thousands of data points, and we choose what we look at based on your history, your symptoms, your physical exam, and even what's been done by other doctors before our visit.